All right, this afternoon we're doing a demonstration with Bill. Bill's complained of low back pain, and he's offered to allow me to do a demonstration of what a typical therapeutic massage might look like. Bodywork appears in many forms, and for me especially, it will be different depending on the needs of the client that day. Some clients will stay fully clothed. In this case, Bill chose to disrobe completely. And this allows us to work directly on the skin. There are some techniques that just work better with skin-to-skin contact. Most of the time, I can work through the clothing if necessary. And in this case, I'm working through the sheet right into the hip flexors, iliacus and psoas. I'm working just medial to the ilium or the hip bone. Palpating in the abdomen. We find a lot of people before they come to Ke Kino have never had an abdominal massage. And we find that it is primary. One of the clients complained to John that, "Why are you working on my belly? It's my back that hurts." And his response was, "Well, the abdomen is the front of the back." So in order to help lower back pain especially, it's really important to work in this area. Earlier, I was working in the pelvis to release psoas and iliacus. Psoas is a deep abdominal muscle that attaches to the front of all the lumbar vertebrae, the vertebral discs, and attaches way up high on the femur. Now I'm working on the respiratory diaphragm and the associated fascia. In doing so, we're also creating some space for the liver to move a little bit more freely. Yeah, I can see there's a moment there where I'm actually tuning in with the liver and releasing some, or asking some of the tendinous attachments to the organs to soften and lengthen. Here I'm releasing fascia. So as I'm working on the outside of the rib cage, I'm actually inviting the tissues all around the scapula and all the way to the spine to lengthen, to soften, to invite more energy flow. In this case, I'm not following any routine at all. I'm literally listening to the body and asking, what's next? What's next? Where do you need me to go? Looking at this, I become aware of some tension in the front of the neck and the jaw, even the cranial bones. Here I'm getting ready to work on the left arm, I believe. So we've covered him up for modesty, but also to stay warm. This is a very slow myofascial unwind. And if you know, most people have forward shoulder posture. Most people in our world, we work at a computer or drive cars, slouch. The muscles in the front of the shoulder become short and tight. So this overstretches the muscles in the back, the upper, causing a lot of upper back pain. Here I am tractioning or stretching the bicep and interior deltoid, moving those towards his head. In doing so, I'm stretching this fascial body that extends throughout the entire body. So I'm noticing softening in the pecs, into the neck and jaw. And you notice how I'm moving the forearm and even the wrist. That helps me to isolate that place where I am asking the tissue to release. So I'm shortening the joints. I'm shortening the elbow and the wrist joints, so that softens those areas. That way I can focus more on releasing the chest, the jaw, and then I'll come back and release the forearm and the hand after I get the releases more from the midline of the body. And you notice the work is slow, mindful, with a lot of presence. In this, I have to be really present in the room, but really into the tissues. So my attention is not on what I'm going to do next. I'm really just in the moment, in the now, noticing each softening and change in the subtle tissues. Again, slowly, mindfully. Here I'm noticing releases going diagonally across the torso to the opposite hip, and just following that. I'm feeling a lot of restriction, I believe, in his pec minor. So I'm softening the tissue around here now and just using a bodywork technique. Looks like some vibration and some fascial stretching or myofascial release. Inviting that release. There you go. Thank you. Clearing the energy on the end of that stroke. And as you can see, even though this is body work, I'm using a variety of techniques, is pulling in everything that I am, every technique that I have learned from classes, from mentors, from experience, and just incorporating it in a combined fashion. And there's elements of Swedish massage, again, in every part of this. You can see every time there's a gliding stroke, that's Effleurage. That's Swedish. That's not Swedish, where I lift up his elbow and place it on my knee. So I'm bolstering the elbow now to help me to hold the arm. I could have held it, but I'm making it a little bit easier on myself. I don't have a huge amount of upper body strength. I mean, average for a woman my age, but I need to preserve my own energy. So I'll use whatever techniques I can use to leverage. Work easier, smarter, work smarter, not harder. There we go. Okay, in this case, I'm working under the body, which is I really enjoy this. Some of the underbody techniques. Sometimes in a session, the client will never actually turn over. When we do a 1-hour bodywork session in clinic, I may work exclusively supine or face up. In this case, I'm noticing vertebral subluxations, or a place where the vertebrae are out of alignment, and feeling the muscle tissue between those vertebrae, and positioning him in a way that softens the tissue, and using the arm as a lever to encourage the softening of the muscles and the realignment of the vertebrae. So as a massage therapist in the state of Texas and in the United States, our scope of practice does not allow high velocity adjustments, or what a chiropractor would do, bone cracking. But I find that I don't need to use them. It just causes me to be a little more patient. You may have seen me do some funny positions there with his head and shoulder. That was an attempt to move the body in a position that would help the vertebrae to move back to its optimum or normal position. You know, as I spoke earlier, bone cracking or chiropractic adjustments are out of our scope of practice. So that encourages me, or gives me the opportunity to be a little bit more patient and a little more creative. Excellent. So here I am using the motion of the leg. Notice that internal and external rotation to stretch or move the tissues in a way that will help them soften. So in some cases I'm stretching, and in other places I'm actually shortening the area where I'm working. So again, there's Effleurage strokes here. Effleurage are gliding strokes from Swedish massage incorporated into any bodywork session. So I'm actually soothing at the end, just like you would get in a Swedish massage, and checking the feet. Yep, I'm already noticing in the video there where there's some muscle attachments on the bottom of the foot that are affecting the pelvis. So I'm loosening and moving the bony structures of the feet. Now, in most of our society, people wear shoes all the time, and the feet lose a lot of mobility, and that will affect everything in the body, all the way up to and including the cranium. So here we're stretching again, and I'm noticing the fascial pull with that internal rotation. The fascia, the muscle tissue is stretching all the way around the hip and up into his lumbar spine. And now as we externally rotate, I'm pulling or stretching on the tissues on the inside of the leg all the way down into the knee and even into the upper arch of the foot. But that's also affecting the muscles in the pelvic floor and encouraging lengthening, softening, better energy flow, and better movement. There we go. So as you notice the draping here, my desire is to always keep my client's modesty protected. So the important bits will always be covered. There's a lot of theories or thoughts or techniques about draping. Some of the really more extreme diaper draping where the sheet is tucked underneath the leg. Personally, I don't like it, but it's an important skill to have. We teach all of our students to do, I guess you would call the most complex draping, but also the most modest. So they have that skill set. My draping is a lot more casual, I guess you would say, with years of experience, and also inviting my clients to become comfortable so they know that they're always covered, and they always have the option to ask for a blanket or more conservative draping. And this is a really fun positional release technique. So here I'm working underneath the body and finding those thoracic vertebrae that are out of alignment or where the tissue is dense or tight or hypertonic around the vertebrae. And by I'm moving the neck to a position of ease. So we're finding where the misaligned vertebrae wants to go back into its optimum position and its optimum ease, allowing the muscles around it to soften, lengthen, encouraging better nerve and energetic flow. And I'm also holding the tight fascia muscle tissue around the cervical vertebrae as well, stretching from one end to the other. And a lot of these techniques come with practice. Often I'll feel something in a bodywork session that I receive, and it will turn on a new level of understanding of intuition in my own practice. Now I'm just noticing the tight muscles, SCM, sternocleidomastoid, a thick muscle that supports your head, helps you hold up your head. It goes from the bony structure around the ear, the mastoid process, and attaches at the clavicle and the sternum. We're continuing to just allow his neck to unwind. And it's not just the neck. So I'm staying underneath the pain threshold and going to just the place where I start to feel a restriction in the body. And I'll follow that restriction, that line of tight tissue throughout the entire body, just asking it, what place are we unwinding now? And now where are we going? So it flows. It'll move in curves and spirals around the body. And it's really fun to just watch. As I'm working on the neck, I'll see unwinding in the rib cage, in the abdomen, in the pelvis, on the inside of the knee, all the way down to the top of the foot. And I'm noticing a softening in the back of the neck, the larynx, the throat, the hyoid where the tongue attaches near the Adam's apple. Watching releases inside the oral cavity, inside the mouth. Even noticing the hard palate softening and moving a little better. So here I'm starting to evaluate the cranial motion. The cranium elongates and widens at a rate of about 8 to 12 cycles per minute. With practice, we learn to palpate those subtle movements. It's been measured with complicated equipment, but we feel these movements of about 1 millimeter or 2. And each of the bones in the cranium moves a different way. We're taught to feel these movements. My thumbs are on the greater trochanter. No, it's not. My thumbs are on the sphenoid, on the greater wings of the sphenoid. Now I've moved to working on the ears. These ears are beautiful handles that the Creator put into our head so that we can traction the temporal bones. And here the video has shifted. We're going to turn him over, but I'd really like to continue talking about the sphenoid and the cranial bones is one of my favorite topics. The sphenoid is one bone that goes all the way across the cranium, and it articulates with most of the other bones in your head, especially the occiput, that bone at the back bottom of your head. So in the middle of your cranium, there is this, we call it the sphenobasilar junction, where the sphenoid and the occiput rock. And as they rock, they move against each other. That creates this cranial motion that causes all of the bones in the cranium to move, but also the entire body. So as the cranium elongates and widens, the sacrum also rocks at that same rhythm. And as the sacrum moves, because the fascia connects everything in the body, the legs will also externally rotate and lengthen and internally rotate and shorten. The fingers, the toes, the arms, the entire body moves with this rhythm. And there are faster rhythms and slower rhythms, but the doctors still called it the primary respiratory motion, which is not the breathing. It is actually this motion that feels like a wave, like a respiration of the entire cranial system. So here we've turned Bill over, and I'm completing the work, and this was a little bit longer session. Gratefully, I'm able to get into more areas and actually give him what is effectively a full body massage in addition to corrective. So whatever is happening with his body, the details is calling me to work on today, I'm able to mostly touch the whole body and give him a more thorough treatment. Typically, that's about a 90-minute session for me to be able to do both. It's usually one or the other. So here I'm uncovering the back of the leg again, and I think I talked about draping earlier. Be gentle with me. I don't do some of the complicated draping that our students will do. Okay, here I'm working on Here I'm working on soleus, the deeper and stronger of the two calf muscles, so it's deep to gastroc. Here I'm just using some sustained pressure. You would call this a myofascial release technique. And I'm using the movement of the foot to help with that release. And as I move up into the hamstrings, which is super important for him, so he's having low back issues. Most of the time, low back issues are caused from a problem somewhere else. So we looked at the hip flexors earlier when we were working on the abdomen. And now I'm finishing up. So we did hip flexors, which would be psoas and iliacus in the abdomen, the muscles in the thigh, and now the back, the hamstrings. And as I'm working here, you noticed I covered him up. I'm working on the hamstring attachments at the sit bone. So that's way up in your business. And, I really do like to honor my clients' privacy. I don't want to be up in their business. So it's a little bit easier for me to work through the sheet. That just gives us both a level of comfort. And in this case, it doesn't take away at all from the effectiveness of the treatment. I have a very strong preference personally of giving and mostly receiving glute work on the skin. So I'm one of those people who's super delicate. And if a therapist isn't super aware, sometimes when they're working through the sheet, it will upset my back a little bit. So in this work, I like to glide all the way from the low back to the hamstring, if you will, in one gliding motion. It's just gentler and more effective for me. If my client left on their underwear or had a preference, then I can absolutely effect a release through the sheet or through underwear or light clothing. So something stretchy like yoga pants, I can work through. Jeans are really hard to be effective. So please don't wear jeans to your service. Now, in our student clinic, our students work through the sheet. They do not do the glutes on the skin, and that was intentional in that student clinic. While they're learning, everyone stays covered, and there's just no issues and no uncomfortableness. My clients typically are quite happy to take off whatever I tell them to. And if I know I'm going to have to do this type of glute work, I would have suggested for them to get completely undressed and covered with a sheet and typically a blanket. Bill is hot-natured and requested no blanket today, which is fine. As you notice, might look like I'm not moving. It might look like paint drying, but here I'm actually gently, slowly, mindfully stretching the tissues. And I might be coaching him and asking him to notice the area where he feels the tightest. I'm bringing his attention into the area, perhaps asking him to breathe into the area. And depending on what his body spirit is telling me that day, I may be asking him to bring a little bit more attention to that area and notice emotions that might be trapped there. For some people, they come in very guarded, and I might be coaching them on how to relax, how to feel safe, how to get into their body, how to actually learn to feel what's happening in their bodies, which a lot of people have forgotten. Here we notice, I just want to call out, I'm working on with a massage cup. So this is a silicone suction cup. I teach a whole CE class on myofascial cupping, which is using techniques similar to this. So in this case, I'm able to pull on the tissue instead of just pushing. What this allows me to do as a therapist is to get more work done faster. This is a very light suction I have on this cup right now, so I'm moving it relatively quickly, and it's an amazing technique for just opening up that fascia in the rib cage. And you'll see me stop along the vertebral segments and actually pull and manipulate the cup. So now, instead of using just a pulling motion on the body, I'm able to pull up with that suction cup and feel the releases all the way through to the front of the body, actually. I love this work. So I've found a vertebral segment that is particularly restricted and left the suction cup there to do its job while I go on to do something else. So this is another way where I'm saving time, getting more work done in the session. And if you notice, I'm not having a conversation with the client. When we recorded this, I actually asked to stay quiet so that I could stay focused and as mindful as possible to really get the best experience or the energy of what it is that I do in this type of bodywork session. So sometimes there is some talking necessary, but I really prefer to have the client focused in their bodies and bringing my attention into the body. The more I'm aware, the more I'm present, the more I'm not talking about whatever problems are happening in the world, the faster and the more effective the releases are. We had some beautiful music playing, and I was hoping that Bill would just relax and feel the music and notice what was happening in his body. And very often I can tell when the client goes somewhere else, when they start thinking or worrying or not being present, the body will actually change. It will actually stop responding. And so I very often have to redirect. Like, how'd you know? I'm like, I don't know. Your body told me. It just stopped working. So I believe here we're finishing up the session. So we'll teach our students to close in a way. I'll let the instructors talk about that. But we never stop. Never stop. This is super important. So I've done a lot of important body work today, and now I want to close it. And I'm checking the energy field. As you notice, my hand further outside of the body. We're balancing, we're soothing, we're closing his aura. My hand's on bladder meridian there, very grounding, and on the bottom of the feet, like bringing him back into this space, back into his body, and closing. And and if this was a person who was super spiritual, I might say a prayer with them, whatever fits in with their spiritual beliefs and is meaningful for them. And we're back. We closed up our demo session, and Bill said, hey, I really have these issues with my low back. I have some more stuff, and my elbow. So we've come back to give him a little bit more direct work. I'm being very specific. I'm really not doing a demo for the camera for this point, but we'll see what's here. So you can see I've done a diaper drape there, and it's a little bit messy. My focus is to make sure we keep all the important bits covered. I don't really like to do all this tucking and manipulating of the fabric, but when I'm going to pick up the leg and move it around is kind of necessary. That's part of the reason why a lot of my body work is done clothed. So very often, if I need to move the leg around and do this kind of thing, I'll do it with the client still dressed. So in this case, I've given him the sheet to hold on to. And I'm noticing we really have some more work to do in his abdomen. So tightness in psoas and iliacus. And I'm softening all the tissue around the place where I'm working. So you can see I've moved to the other side of the table for leverage. Again, making it easier on my body. And I need to get deep into the abdomen. So I'm bringing all that tissue with the leg with me, so my hand can get a little bit deeper and really get to that place that needs to unwind. There we go. Nice. So here I'm really palpating. I'm noticing the tissue's softness, how it moves. Beautiful. So the words that you hear coming out of my mouth, nice, beautiful, that is actually something that you might hear me say in a session. And it's not really complimenting my work so much as the body, the totality of what just happened. There was a shift that happened in the room. And what naturally comes out of my mouth is like a compliment to spirit, a compliment to your higher self or your inner physician for there. That work happened. It happened nice. It happened smooth. It happened quickly. Thank you. We did some demo of unwinding, and I got some significant releases in unwinding his arm previously, but he's got some specific issues with his elbow. So I'm really addressing some more details here. Teres, the tendons around the elbow. And again, every session is different. And I treat every part of the body. A lot of times we might refer someone to our corrective clinic if they're having specific issues with something like this. And honestly, for this client, that would be the best place for him right now, just based on the totality of what's happening with him. But, you know, I treat everything. My early training was in a lot of corrective work and medical massage, but I've really moved to a different place that encompasses the energetic, the cranial sacral, the emotions that are held in the body. And in this case, you know, an emotional release was not what his body was asking for today. And every person is different. Honestly, it just depends on the day. It depends on the day and the client and what's going on with their body, what happens. But it's very often that I'll coach them on how to feel into their body, and they'll start to feel. They'll start to feel. We as a society have become very good at not feeling, at getting away from our feelings as a mode of survival, as a mode of alleviating suffering and getting through the day. We learn to simply not feel. We don't feel our feelings. We don't feel the sensations in our bodies. We don't feel our emotions. And a lot of what my work is helping people to feel their emotions again. And it's scary and it's hard. And at the end of that is freedom. Freedom. Freedom from the limiting beliefs. Freedom from the trauma trigger responses. Freedom from the physical pain that comes as a result. And I thank you, Bill, for your service today.